Throughout the pandemic, there have been many options for COVID testing here in North Dakota, from first having PCR tests to being able to buy an over-the-counter rapid test at your local pharmacy. But drive-through testing has recently taken a hit. Reporter Adrian Oglesby shares more on why the North Dakota Department of Health says they haven't been seeing as many people taking advantage of this option.
The number of COVID-19 tests being distributed in the state is rising day by day. Chief Nursing Officer at the North Dakota Department of Health, Nicole Brunel, says in November and December alone, there were between 110,000 and 115,000 tests issued.
This month right now, not including today's testings, we're almost at 120,000. And we still have another week and a half, 2 weeks to go in this month. So we're definitely going to see record numbers of testing since the beginning of the pandemic.
She says there are 30 free sites throughout the state, and majority of those are by appointment, but there are less than a handful of drive-through sites.
With our weather being as crazy as it is and the cold temperatures, there's very few areas that have that ability to have a drive-in.
Brunel says as the weather gets warmer, more drive-through testing sites will open, whether it be a pop-up event or a more consistent testing location. One of the drive-through sites available is through the Upper Missouri District Health Unit at Williston State College. Each Monday at the Art Wood Building, a drive-through COVID-19 testing site is set up. Daphne Clark with the Upper Missouri District Health Unit says they have PCR throat swab tests available at the college.
At least then people can stay in their cars and we're not exposing other people around them. People aren't congregating in large masses of people, so they can stay separated in their family units and their vehicles.
Results come back typically within 3 to 7 days, which in some cases is not soon enough, and that is where the walk-in testing areas come into play.
Majority of our facilities, our large community testing sites, have 2 doors, one's for asymptomatic, one's for symptomatic, and it's usually pretty well divided.
Brunel says the precautions taken for the testing centers are very strict. Both Brunel and Clark agree that no matter how you would like to be tested, as long as you are doing it, you are helping to save our community.
If people can get tested, then they know if what they have is a cold or the flu or if it is COVID, and then they can take the precautions to protect the people around them.
Reporting for KX News in Bismarck, I am Adrian Oglesby.
Brunel says the recent peak in testing numbers is from the number of travelers, those who are sick with symptoms, and asymptomatic testers. There are also concerns over people contracting the flu, but she says being proactive about testing is a way to help. For more information and a list of testing locations, visit our website at kxnet.com.